Hey everyone, in this video I am showing you a quick neurotoxin treatment. These are all areas that we teach in our level 1 Botox course. As you can see, the first thing I am doing is marking up the patient. So obviously her makeup was removed, she was cleaned with alcohol, and now I'm just kind of marking her up. You could see she doesn't have a ton of movement because she has been getting neurotoxin for a while now. She's pretty good with coming every 3 to 4 months and keeping up with her treatments. So that definitely helps when we're trying to let the neurotoxin treatment last as long as possible. So as you can see, marked up her frontalis. I'm never injecting through my dot, always right next to it, just for sterility reasons. We want to be as clean as possible. But you can see I'm treating from lateral border to lateral border to ensure that she doesn't get any kind of spocking once the treatment settles in. So I'm treating all the way across her forehead. She has a pretty tiny forehead, so she gets a small dose in this area, but it's just enough for her to ensure that it is treated and she doesn't have those crazy lines across her forehead. Next, we are moving down to the glabella. So you can see I'm treating the procerus, which is in the center, and 2 corrugators on either side. Most patients will have 2 injections in their corrugators, a medial and a lateral. So you can see that's what I am treating here. She surprisingly doesn't have a very strong glabella, which in most patients, this is the area that we treat the most aggressively because it is pretty strong in most patients. But for her, she only requires a small dose. Next, moving to crow's feet, so treating the orbicularis oculi muscle. You can see she's very vascular, so pulling that skin nice and tight really helps to ensure that I can see where the vessels are and avoid them if I can, not to give her a bruise. So 3 injections on either side, always injecting up and away the eye, and then making sure when I'm cleaning that I'm wiping in the appropriate manner. So always away from the eyes, up on the forehead, making sure I'm not wiping or potentially moving that neurotoxin anywhere I don't want it to be. So that is it. Thank you so much for watching, everyone. We'll see you in the next one.